2:13 a.m. The doors didn't open. They exploded inward. 3 GSW SEAL sniper BP crashing. A body slammed through trauma bay 4. Blood soaking the sheets. Oxygen mask fogging with shallow breaths. 2 rounds out. The trauma surgeon barked. Greater than third is too close to the heart. If we touch it, he dies. Greater than he's not going to make it. A nurse whispered. Flatline. For half a second, no one moved. Then Ava stepped forward. Don't cut, she said quietly. The surgeon didn't even look at her. Step back, nurse. Ava's eyes locked on the monitor. Pericardial tamponade. The rounds sealed the bleed. If you extract without pressure redistribution, you'll trigger cardiac collapse. The surgeon froze. No civilian nurse talks like that. He turned slowly. How do you know that? Ava didn't answer. She was already scrubbing in, and that's when the hospital windows started shaking. Rotor blades. A Navy helicopter descending onto the roof and standing at the ICU doors was a SEAL admiral who hadn't seen Ava in 12 years. Before we begin, if you love intense military medical stories like this, take 2 seconds to comment where you're watching from and hit subscribe, because tonight an ICU full of experts is going to call it impossible. And one rookie nurse is going to refuse to accept that answer. 2:13 a.m. The doors didn't slide open. They slammed against the walls hard enough to rattle the glass. 3 GSW's male. Late 30s. No ID. Possible military. A stretcher burst through the corridor. Wheels fishtailing on polished tile. The man on it was built like steel and pale like paper. Blood soaking through gauze at his chest and shoulder. One round had torn through his right flank, another through the upper arm. The third, on the one nobody liked, was buried just left of the sternum. BP 70 over palp. A tech shouted. We're losing him. The trauma surgeon, Dr. Halpern, was already gloved and moving. 2-0 now. The third we evaluate. No one said what everyone was thinking. If that bullet was where it looked like it was, evaluating might be the last thing they ever did for him. They operated fast. First round out clean from the flank. Second extracted from the arm with minimal vascular damage. The monitor steadied for half a breath, just enough to pretend hope was reasonable. Then the echo came from the imaging screen. The third round sat 3 millimeters from the left anterior descending artery. Too close. Too intimate. If we touch that, Halpern muttered, jaw tightening, we tear the LA and he bleeds out before anesthesia can blink. Someone whispered, then we close, another voice lower. We stabilize and transfer. But transfer meant time, and time was the one thing bleeding faster than he was. Ava had been in the room since the stretcher hit the wall. Blonde hair tied back tight, blue eyes steady, rookie badge clipped at her collar. She'd assisted quietly, efficient, invisible. She watched the monitor instead of the wound. Watched the slight narrowing pulse pressure. Watched the neck veins distend almost imperceptibly. Watched the way the systolic number trembled but didn't collapse. He's tamponating, she said softly. Halpern didn't look up. Nurse, step back. She didn't move. The rounds sealing the rupture, she continued. Voice level pericardial tamponade is maintaining forward flow. If you extract without decompressing first, you'll trigger cardiac collapse. The room went still in a way that had nothing to do with medicine. Halpern finally looked at her. Not irritated. Not yet. Just measuring. You're 7 months out of orientation. He said, you don't lecture me in my O. A couple of residents shifted uncomfortably. Ava nodded once. Then don't extract it, she said. Create a controlled pericardial window first. Redistribute pressure. Cross-clamp proximal LA for less than 15 seconds. You'll buy enough time to remove the round without shearing the artery. The anesthesiologist blinked. A resident swallowed. That wasn't textbook language. That was field language. Halpern's eyes narrowed. That procedure isn't taught in civilian residency. Ava met his stare evenly. I know there are moments in an operating room when hierarchy matters more than oxygen. This was one of them. You pass meds, Halpern said, quiet but sharp. I perform surgery. Ava held his gaze. If you close him, she said, he dies within the hour. The tamponade will progress. If you open without decompressing, he dies on the table. There's a third option. She didn't raise her voice. Didn't rush. You create a window at the pericardium. Suction ready. Manual compression on standby. Clamp ready. 14 seconds. That's what you get. The monitor dipped slightly as if to underline the argument. Someone at the back whispered. He's crashing. Halpern looked at the screen, then at her. Where? He asked slowly. Did you learn that? Ava's hands were already at the scrub sink. Somewhere loud. She answered. She didn't elaborate. Didn't offer credentials. Didn't defend herself. She just scrubbed long strokes, controlled like she'd done it 1,000 times before the fluorescent lights ever found her. Halpern stood frozen for half a beat too long. Then he exhaled once. Fine, he said, voice tight. You assist. You speak only when I ask. She stepped into position opposite him. The heart monitor began to stutter. The anesthesiologist called out, pressures dropping. Halpern cut. Ava leaned in. Slightly left, she murmured. There. The first incision exposed the pericardial sac. It bulged like a held breath. Window, she said. Halpern hesitated a fraction of a second, just enough for the monitor to waver again. Then he incised. Blood spilled dark and immediate. Suction. Ava snapped sharper now. The sac decompressed. The systolic number steadied by a thread. Clamp ready, she added. Halpern positioned. On my count, she said quietly. He glanced at her, almost annoyed at himself for doing it. 3. Clamp. 2. Suction. 1. He extracted the bullet. For 8 seconds, nothing happened. Then the heart rhythm collapsed into a thin mocking line. No pulse, the anesthesiologist said. A resident swore under his breath. Halpern's face drained. Ava moved before anyone else could. 2 fingers, precise placement at the myocardium, not CPR, not standard compression. A focused manual pressure along the ventricular wall, guiding contraction instead of forcing it. Come on, she breathed, barely audible. The monitor flickered once, twice. A weak rhythm returned, irregular, but alive. The room exhaled in fragments. Halpern stared at her hands like they belonged to someone else. And that's when the windows began to shake. At first, it sounded like distant thunder, then closer, then unmistakable rotor blades chopping the night air above the hospital roof. The fluorescent lights trembled slightly in their fixtures. A nurse near the door whispered, "Is that?" No one answered. The monitor beeped, fragile, but steady. Ava didn't look toward the sound. She kept her fingers where they were, stabilizing the rhythm, eyes locked on the numbers. Outside, the helicopter descended, wind rattling the glass, and somewhere in the hallway beyond the O, boots hit tile with disciplined urgency. The doors at the far end of the surgical corridor swung open, and the man walking through them had the bearing of someone who didn't need to raise his voice to command a room. The rotor wash thudded against the roof like a second heartbeat layered over the one Ava was holding together with 2 steady fingers. The O doors swung wide and the presence that entered didn't shout, didn't rush. It absorbed the room. The SEAL Admiral stepped in wearing a dark civilian jacket over a muted shirt, haircut short, gray at the temples, posture carved from decades of command. His eyes went straight to the table. Then to Ava. He didn't flinch. He didn't smile. He just said her name low enough that only the people closest heard it. Ava. Halpern glanced between them, confusion flashing across his face. You know my nurse? He asked, irritation creeping back into his tone. The Admiral didn't answer him. His gaze stayed on the monitors, on the fragile rhythm Ava was guiding back into order. Status, he said calmly, and for the first time that night, the surgeon answered someone else. He coded, Halpern admitted. We extracted the 3rd round. He hesitated, jaw tightening, assisted. The Admiral stepped closer to the table, careful not to cross sterile lines, eyes scanning the sniper's pale face. Lieutenant Cole Mercer, he said quietly, as if confirming the man was still there. 3 tours, long-range recon. A best shot I ever trained. The name seemed to hang in the air, heavier than the rotor noise outside. Ava felt the subtle tremor in Mercer's chest under her fingers and adjusted pressure slightly. Rhythm's weak, she said focused. But it's holding. The Admiral nodded once, slow. It needs to hold. His voice wasn't demanding. It was personal. Security flooded the hallway beyond the O. Naval personnel in dark uniforms, controlled and efficient, locking down corridors without panic. Hospital administrators hovered at the threshold, whispering about liability and clearance levels. Halpern bristled. This is a civilian facility, he said sharply. You can't just. The Admiral finally turned his head toward him. Doctor, he interrupted, voice even. 30 minutes ago, my sniper was ambushed less than 4 miles from here. If we diverted to a military hospital, he would have bled out en route. You were the closest level 1 trauma center. His eyes didn't soften. That's why we're here. The implications settled heavily. This wasn't an accident. It wasn't random violence. It was targeted. And whoever pulled the trigger had known exactly where Mercer would be. The monitors wavered again. Ava felt it before anyone announced it. The rhythm grew erratic, almost hesitant. He's fighting the clamp trauma, she murmured. Halpern adjusted his grip instinctively. Pressure's dipping, the anesthesiologist called out. Ava didn't look up. Warm saline increased by 20 milliliters. He's cold. A resident hesitated. You're not in charge. Halpern cut him off. Do it. The command surprised even him. Ava shifted her fingers, micro-adjusting the ventricular support. I'm guiding contraction rather than forcing it. Cole, the Admiral said quietly from beyond the sterile line. Voice steady but close enough to be heard. You don't get to quit in my O. For a split second, Mercer's eyelids fluttered barely, but enough that Ava saw it. Pupils reacting, she said under her breath. The anesthesiologist leaned closer. He's trying to come back. The room felt suspended between 2 breaths. Then Mercer's lips moved dry and cracked. It wasn't loud. It wasn't dramatic. Just a rasp that forced everyone to lean in. They knew, he whispered. The Admiral's jaw tightened, a flicker of something darker crossing his expression. Knew what? He pressed. Mercer swallowed, eyes barely open. Root. One word. Then his rhythm faltered again, collapsing into chaos. We're losing him, a tech shouted. Ava reacted instantly, pressing firmer, recalibrating pressure along the ventricular wall. He's not crashing from blood loss, she said quickly. It's electrical instability. Halpern looked at her. We shocked him already. Not wide, she replied. Targeted lower jewels. He's not empty. He's confused. Halpern hesitated only a fraction of a second. Before nodding. Charged to 50. The paddles were positioned with surgical precision. Clear. The shock jolted Mercer's body just enough to reset the rhythm. The monitor steadied into a fragile line that trembled but refused to disappear. The room exhaled in fragments. Ava slowly eased pressure, watching to make sure the heart held on its own. It did. Weak but stubborn. The Admiral closed his eyes briefly, not in relief, but in acknowledgement. Wait, he was shot leaving a briefing, he said quietly, almost to himself. Domestic soil. That wasn't a robbery. Halpern glanced at him. You're saying this was an assassination attempt. The Admiral didn't look away from Mercer. I'm saying someone knew exactly where he would be at 1:47 a.m. The weight of that settled over everyone. This wasn't just trauma. This was an operation bleeding into a hospital corridor. And Mercer had said they knew the route. Ava's mind worked through that detail automatically. Routes weren't guessed. They were shared. Someone had access. Someone had leaked it. She shifted her attention briefly to the IV line, scanning the drip rate, the bag, the clamp position. Everything appeared standard, but her eyes lingered an extra second. Something about the infusion concentration made her pause. She didn't say it yet. And not until she was sure. Instead, she stepped back finally, hands lowering as Mercer's heart carried itself forward without her guidance. He's stable for now, she said softly. Halpern pulled off his gloves slowly, studying her with a look that wasn't irritation anymore. It was calculation. You don't get that lucky twice, he muttered. Ava met his gaze evenly. It wasn't luck, he almost argued, but the Admiral spoke first. She never relied on luck. The words were quiet, but final. Halpern's eyes flicked between them again, the pieces starting to assemble in his mind. You were military, he said to Ava, not a question. She didn't answer directly. I was where bleeding happened, she said instead. The Admiral's expression didn't change, but something like restrained grief moved behind his eyes. He had thought she was gone. 12 years gone, and here she was holding his sniper's heart together in a civilian hospital under fluorescent lights. Outside the O, news of the helicopter landing had spread through the building. Phones were out. Whispers bounced through corridors. Administrators were already calculating statements. And inside Trauma Bay 4, the air shifted from chaos to controlled tension. Mercer's breathing deepened under the ventilator's support. The Admiral stepped closer to the glass, eyes never leaving him. "He's not safe yet," he said. Ava nodded almost imperceptibly. "No," she agreed. "He's not. Because someone had known his route. Someone had planned the ambush. And if they knew that, they might know he survived." Before the Admiral could respond, a security officer stepped into the doorway. "Sir," he said tightly. "We've secured the perimeter, but there's something else." The Admiral didn't turn. "What?" The officer swallowed. "The vehicle that transported him. It wasn't the one assigned to the op. It was rerouted last minute." A silence followed that felt colder than anything the rotor wash had brought with it. Ava's gaze shifted back to the IV line, then to the chart, then to Mercer's fragile rhythm, a route vehicle, a leaked route, and a heart that had just barely chosen to keep beating. If you think this was just bad luck, or if you think someone inside that operation wanted him dead, comment below which one you believe, because the next detail is going to decide whether this was a failed hit or the beginning of something much worse. The Admiral finally looked at Ava again, voice low enough that only she heard it. "Oink. If this reaches the hospital floor," he said, "we won't just be fighting for his life." Ava didn't blink. "We already are," she replied. And down the hallway, a cart rattled sharply against the tile, as if someone had moved too fast and hit something they weren't supposed to. The sound of the cart hitting tile echoed longer than it should have. Not loud enough to justify panic, just sharp enough to feel wrong. Every head in the turned toward the hallway instinctively. Naval security moved first, controlled and efficient, weapons low but ready as they swept past the glass. Ava didn't follow them with her eyes. She watched the monitor. Mercer's rhythm was still fragile, stable in appearance, unstable underneath. "We need ICU, Halpern said, forcing his voice back into clinical shape. "Now." The Admiral gave a short nod. "Full lockdown on this wing," he ordered quietly. No shouting. No drama, just consequence. Within seconds, the surgical corridor shifted from hospital chaos to military precision. They transferred Mercer carefully, lines intact, ventilator humming steadily as the bed rolled toward the ICU. Ava walked beside it, one hand near the IV pump without touching it, watching numbers most people would ignore. Oxygen saturation stable, heart rate irregular but persistent, blood pressure barely holding. She studied the anticoagulant infusion again. The concentration label looked right. The rate looked right. But something about the clarity of the fluid bothered her. A shade thinner than it should have been. She didn't say it yet, not without proof. When they reached ICU, naval security stationed themselves at both ends of the hall and civilian staff exchanged uneasy looks. This wasn't routine anymore. This was something else. Inside the ICU room, the Admiral stood near the window, posture rigid but controlled. Halpern removed his mask slowly, glancing at Ava. "You don't get to vanish after this," he said quietly. It wasn't accusation anymore. It was disbelief. Ava adjusted the ventilator settings with calm precision. "I'm not planning to," she replied. Halpern's eyes narrowed slightly. "You walked into my and cited a restricted forward surgical protocol. That's not something you pick up from YouTube."